I'm at King's College Hospital with a wonderful doctor, a kind doctor, and somebody who's very easy to talk to.
Thank you.
Dr. Barami, could you give me a little bit of your background?
I'm a consultant rheumatologist. I joined King's College in August last year, and I've come from UK practicing rheumatology there for 15 years and moved to UAE.
Expertise here to the hottest time of the year, my word. Are you finding here, is there a difference in quantity of men and women, or worldwide, are different countries affected differently by osteoporosis?
Osteoporosis, yes, it's more often prevalent in female, in the order of 1 in 3 above 50 can have osteoporosis. But that's not the case because of the hormonal protection. In case of a male, it's around 20%, 1 in 5. We see that in an older person, more than 50.
I'm big on osteoporosis because that's my thing.
Sure.
But rheumatology, I don't really understand the difference.
Osteoporosis is a condition affecting the strength of the bone, where a person is more likely to sustain a fracture, even from a simple fall. That evaluation of bone health comes under the osteoporosis part of the condition osteoporosis, whereas rheumatology deals with other conditions affecting joints, where a person can get arthritis, where there's inflammation, or it could be a wear and tear arthritis. And rheumatologists also deal with the conditions affecting the tendons, the muscles, where we often find inflammation, most often a part of an autoimmune process where an autoantibody is fighting against that person's body and causing inflammation.
Do the two things have anything in common? If you have one, are you going to get the other?
A person who has got inflammation in an inflammatory condition is at more risk of getting osteoporosis. Let's say, for example, a person has got rheumatoid arthritis, which is an autoimmune condition. The body attacks one's own joints, producing inflammation. That inflammation can put the person at risk of getting osteoporosis when you compare with the person who don't have rheumatoid arthritis.
Right. So that goes on your list when you're questioning me. Is there anything significant about UAE with areas in the world having osteoporosis more? Or you've said that you treat older people in the UK and younger people here. Is that because you don't find out that the younger people in the UK have it?
Younger people are generally less at risk of sustaining a fracture from a simple fall because their bones are stronger. They have got the hormonal protection unless they have an underlying condition, which we ask for in the evaluation of the bone health part, the program. Awareness is something which is very important in this condition because it's most often something often unnoticed, whether a person's bone health is, has got a poor bone strength.
Yet another silent disease.
Correct. So for that reason, awareness is more important. Getting it checked is important.
Yeah. And
often a country where there is more often older population, we tend to see more this condition because as one's age advances, are at more risk of sustaining a fracture. And
it is only going to become more prevalent because we are alive for longer now.
Correct. So that is the more advancing age, the beneficial effects on one's own body for the bones are getting lesser.
Yes.
Let's say in a female, the hormonal effects lose when they reach menopause.
A few people have messaged me and said, but DEXA scans are so expensive. And I'm thinking, but if I don't get a DEXA scan and don't find out that I'm going to possibly fracture a leg, arm, whatever, then I'm going to be in hospital.
People don't know whether they have osteoporosis or whether their bones are weak. So it's best to get a DEXA scan. And DEXA scan is not that expensive when you look at, there are packages available in King's College where we do discuss about their general health as well to assess the risk of osteoporosis.
This is the bone health check.
Correct.
So what does that encompass?
So that includes a DEXA scan, seeing a rheumatologist or a specialist to evaluate what is the person's risk. We do some blood tests as well along with that to ascertain if there's any underlying condition.
And what is that blood test for that's included in the package? What does that show?
It checks for one's calcium, we check for vitamin D, we check for kidney functions, blood count, proteins. So that is a comprehensive package, including a DEXA scan and seeing a specialist.
Then you get the results.
Correct.
When do you then move forward to the blood test you did on me? What is that called?
That was after I assessed you, I felt we need more information. So that's not generally done for every person. If the clinician like me wants more information on how your bone health is, if I do a special test called bone turnover marker, which gives me some indication about are you a heavy bone loser or you're relatively spares your bones. So individuals are different. So there are some tests available which are special tests.
Are you seeing bone in the blood then? Is that the aim of the blood test?
They are chemical markers indicating whether the bone cells are increasingly active or are they increasingly formed. It gives us an indication from that, indirect indication.
And everybody at a certain age has a percentage, sort of a bracket that it should be in, and shows, because at different ages you're losing more bone or less bone.
Take reference as premenopausal and postmenopausal.
Right.
So that is a broader criteria.
Biggest
criteria we use
Right.
for assessing these markers.
So that's women.
These markers.
Women, then. So unfair.
But there are good medications too.
Right. Next question then. Are you stopping it where it is, or are you getting better bone health with the medication?
Best is to say it's a better bone health because there are different forms of treatment. Some individuals who are extremely high risk of sustaining a hip or a spine fracture might need a specific treatment which can be only given in certain conditions. If their bone health is very bad and they cannot be continued on long term, for those individuals, we have to give a bone forming medication. Other individuals, we give a medication to prevent bone loss, thereby stabilizing it. So it's a better bone.
Mean that I'm not going to be bent over as I get older.
Correct, that we don't want people to sustain fractures in their spine, which goes unnoticed.
I went to my first ballet class today for my posture.
Excellent, very good.
I thought you'd be impressed with that. I was wearing jewelry on the DEXA scan, and a few people were worried about me wearing my earrings. What would you say about that?
There's nothing to be worried about. If there's any jewelry, we ask them to remove only in the area where the spine is scanned.
Right, and
not anywhere else.
I don't have any jewelry down here. The DEXA scan is looking at your bones from your waist down to your hip.
The hip is scanned separately. For the spine, it's measured from the lower end of the rib cage, where it just enters the pelvis. So we measure 4 vertebrae in the lumbar spine.
And why does osteoporosis only hit this area? Why doesn't it hit higher up in the back or legs?
Osteoporosis affects any bone. So it is not only it affects hip or spine. It can have impact on any bone in your body, including your wrist or your lower leg. The purpose of we measuring only the hip and spine is these are the 2 areas, if one sustains a fracture, likely to get more morbid and their general health.
So that's the worst area.
Yeah, it's something what we call a major fracture.
The difference between an MRI and a DEXA scan?
MRI is more a detailed scan, and it can give information about how the bone is or the adjacent muscles. A DEXA scan is much more simple. We measure only the bone thickness, and so it's usually get done in 15 minutes.
Right, and it's cheaper.
It is when you compare with an MRI.
What is Prolia?
Prolia is an injection treatment available to prevent the bone loss. It's a once in 6-month injection, which is a subcutaneous injection, which like the diabetics inject the insulin. A very simple injection. The chemical or the pharmacological name for that is denosumab. It's a monoclonal antibody which works very well in people with osteoporosis. We'll need a medication to prevent further bone loss.
And is that a temporary medication?
We give a simple medication called alendronate, which is different from denosumab or the Prolia, which is an injection form of treatment. It's very simple to take once in a week, and it's taken on an empty stomach.
Is this a forever pill or is this a temporary pill?
It's given initially for 2 to 3 years and reassess as we go along. Some individuals, it works very well, and then one clinician like myself might decide to give a holiday to see if it's not needed for further few more years.
So can your body sort of rejig itself and say, I've had this medication, this is how I'm supposed to work, and move forward working itself? Is that what you're saying?
We often see both ways, that some individuals don't need further medications because their osteoporosis is very mild and they stabilize. And we have to, however, keep an eye on them with regular blood tests and DEXA scans in a regular interval.
How often?
It depends on the individual and depends on the treatment. If an individual is at high risk and if the treatment is working or is having fractures despite of treatment, we will do scan earlier. Otherwise, a gap of 2 to 3 years.
If I said I didn't want to take the pill that you're suggesting, is there anything else? Can I just take calcium supplements and eat differently to make a difference, or not really?
Lifestyle is very important. However, because you are on HRT patches and you're doing all the regular good things, you're ticking all the boxes. Despite of that, I can see your blood tests coming back up.
Okay.
So, and that is the instance where I would recommend starting a medication.
Okay. Well, I came to you for the answers and I've got the answers. Thank you very much. The symptoms of osteoporosis, how can people have any idea that they have it, even though we have mentioned it's a silent disease?
Very few people may have minor back pains when they have started sustaining fractures. That's the only indication where they may have an underlying osteoporosis.
So a fracture is pretty much the only way of knowing?
Because that affects the integrity. Or it can be picked up if an X-ray has been done for another reason and we find that the bones are weaker. They may have an underlying condition. It's best to get it checked. For example, if they are on prednisolone, which is cortisone steroid injections, or tablets for a longer term of more than 3 months, we always recommend to have a bone health evaluation.
Wow, I don't know that would a doctor necessarily ask that. Not every doctor, probably. If you have a good doctor, they will.
Sure, every doctor will do that.
The answer to all of this is go and get a DEXA scan. Doesn't matter how much it costs. You have to have a DEXA scan before you have your first fracture.
I would also suggest get a bone health check, which is a comprehensive evaluation.
Yes, yeah.
Because DEXA comes only a part of the evaluation.
Right.
Person may have a normal DEXA scan, but he may be at high risk, so he will get more advices on what steps and when should he repeat the DEXA scan, or should he need or blood test, additional blood test. That's where the entire evaluation would benefit.
Right.
So
if you're UAE, Dr. Barami is your guy.